Welcome to the 37th Annual Charles E. Steinberg Lecture. On the occasion of Charles's 70th birthday, the department established the Charles E. Steinberg Lecture Series. Charles was a staunch and valued member of the faculty and was appointed clinical professor of psychiatry. He lectured, mentored, supervised medical students, residents, and forensic psychiatry fellows. He was active nationally and at Apple, was involved in the forensic psychiatry course, and was awarded the highest award for a non-member, the Red Apple Award, for all his contributions. When I came here to Rochester to study with George Engel, I learned from Dr. Engel the importance of being able to speak and understand the language of the system you're consulting to. As a forensic psychiatrist, I am consulting to the legal system. And it was Charles Steinberg who helped me to learn the language of the legal system. And beyond the language of the legal system, the theory and the thinking process of attorneys and people involved in law. With that important lesson, when I turned to forensic psychiatry, obviously I needed to learn that system. And as I said earlier, Charles was instrumental in my learning about it. With his death in May of 1999, the Department of Psychiatry lost an outstanding teacher, esteemed colleague, and loyal friend. So as we gather here today for the 37th Annual Charles E. Steinberg Member, we honor his memory and his legacy. And to introduce our Steinberg speaker, I call upon now Dr. Rob Weissman.
Thank you, Richard, and thank you everyone for attending today, both in person and on Zoom. I'm Rob Weissman, Director of the Fellowship in Psychiatry and Law, and it's a pleasure to be here for the annual lecture. Before I start, on behalf of the department and Chair Dr. Ben Lee, we have a very interesting speaker today, a good friend and colleague who I want to introduce now. Before I start, just some housekeeping. Those of you who are here present, if you can hold questions till the end for Dr. Weiss, and then we'll attend to those. Those of you who are attending on Zoom, please enter your thoughts and questions on the Q&A portion of your Zoom meeting. So it is my distinct pleasure to introduce Dr. Kenneth Weiss. He is our 37th Charles E. Steinberg Invited Lecturer for the Fellowship in Psychiatry and Law. I feel very fortunate to have met and know Dr. Weiss both as a colleague and a friend. I was first introduced to him by Dr. Saccone many years ago and have long hoped for the opportunity to bring him here to the university. Dr. Weiss practices and teaches in Philadelphia and serves as clinical professor of psychiatry at the Perelman School of Medicine at the University of Pennsylvania. He is a distinguished life fellow of the American Psychiatric Association and a fellow of the College of Physicians of Philadelphia. Over 45 years in forensic practice, Dr. Weiss has contributed extensively to the justice system in both civil and criminal matters, with particular expertise in developmental disabilities. His scholarly work includes more than 200 publications, among them significant contributions to developmental disorders and the history of psychiatry. He is also co-editor of a forthcoming volume, Expert Mental Health Opinions from Inquiry to Knowledge. This explores the theory of knowledge in forensic psychiatry. In my experience in working with Dr. Weiss, I've been consistently impressed by his professionalism, intellectual rigor, and thoughtful approach to complex forensic evaluations. He brings not only deep expertise, but also a remarkable sense of fairness and humanity to his work with patients as well as examinees. As an educator, his clarity and insight reflects decades of experience as both an academic and a practitioner in general and forensic psychiatry. Today's topic is also of particular interest to me personally, given my work with law enforcement professionals and their departments across New York State. Today, Dr. Weiss will present Autism Spectrum Disorders and American Policing. Please join me in welcoming Dr. Weiss as our 2026 Charles E. Steinberg Lecturer in Psychiatry and Law.
Thank you, Dr. Weissman, Dr. Ciccone, Dr. Lee, for hosting me here today. I was prepared to say how honored I am to deliver the Steinberg Lecture until I saw the list of people who had preceded me. And now I'm really humbled by it. A lot of these people are some of my favorite people in psychiatry and law, as well as judges and other people who are important in understanding the communication between psychiatrists and the legal profession. So I'm indeed honored to deliver this talk today. And a couple of things. First of all, I want to make sure you understand I have no conflicts of interest. But more important than that, I want to make sure you understand that this talk is about autism spectrum disorder, the people who fall into that category, and how we can best help them and help their families navigate certain situations in the community that may bring them into contact with police and the criminal justice system. And this is a pro talk with respect both to individuals on the spectrum and with respect to the police, who have a very difficult and dangerous job and do the best they can. But I think there may be an opportunity for people like you and me to communicate more to law enforcement about differences that we see in people with autism spectrum who might fall under situations that are uncomfortable for them. And I'll describe some of them to you. But first, I'm going to read something to you, which is from a law review article. It opens the law review article by Christine Say in 2014. Picture this. A man at a fast food restaurant walks toward his table with a tray full of food. A woman who is on her cell phone passes by the man and is not paying attention. She bumps into the man and his food spills all over him. The man panics. She begins to apologize, but the man cannot focus. He is upset about the food, upset that it fell, and upset that the woman touched him. The woman continues to apologize and suddenly grabs his arm to clean the food off of him. Shocked, the man pulls his arm back and swings his other arm at the woman. He hits her. She is on the floor. He did not mean to hit her, but he did not stop himself either. It all happened so fast. He simply could not deal with all that had happened at that moment. The man is prosecuted for assault and battery. While on the stand, he barely reacts. He is nervous. When the attorney shows him a picture of the woman's injuries, he does not act shocked. He does not say that he is sorry. He does not say anything. The jury, not understanding why he appears emotionless, does not like him. He ends up pleading guilty. At his sentencing hearing, the man's attorney argues for leniency. The judge asks the man if he understands that his actions were wrong, and the defendant shrugs. Believing that the man is unwilling to take responsibility for his actions, the judge gives him the maximum sentence. Okay? This is a little food spill at a fast food restaurant that turns out to be a tragedy. And can we fix these things? We can't necessarily fix them in real time in the community. but there's something perhaps that we can do to educate the community and especially work with law enforcement to help understand the ASD phenotype. So the phenotype that I'm talking about, what I'm talking about is the outward appearance of individuals without necessarily getting to their body chemistry or their brain chemistry or the neurophysiology of their condition. I'm simply talking about how they may appear to others, which is naturalistic within the community. So I'm going to say some things now about the ASD phenotype. I'm going to show you some videos along the way, but I'm not going to show you too much of videos of police-citizen interactions that are upsetting. They're upsetting enough even to think about, and even this little vignette that I read to you is just to sensitize you a little bit to the problem. But out there in the real world, there are some really bad things that have happened due to misunderstandings, miscommunication, and perhaps a general lack of education about the autism spectrum disorder phenotype. The behavior of individuals with ASD in the community may be a magnet for suspicion. And I previewed some of this in the anecdote that I read to you. They're misunderstood socially due to awkwardness. And I'm talking about the higher to mid-range functioning people who are living in the community and who may encounter other citizens and may encounter law enforcement. Their impulse control may not be smooth. It may be worse than they would hope it would be because they don't get a chance to think through situations. They don't necessarily have as good a sense as they should about how other people are thinking and feeling and how others regard them, which is to say they may lack theory of mind. They may have obsessive interests and do not know they are boring others in social situations. They adhere rigidly to rules in a way that is off-putting to many people. And finally, although I'm not going to get into this in detail, they may be susceptible to being exploited and manipulated by others to commit things like internet crimes and monetary crimes. In terms of social cognition, it's relevant to criminal profiling and to confessions and to criminal responsibility versus diversion to non-criminal outcomes, which is very important. As you heard in the anecdote, sometimes individuals with autism spectrum, because they have a facade, and I'm calling it a phenotype here, which is sometimes cold and calculating, but other people on the spectrum are bubbly and forthcoming, and maybe too much so, which is not to say that all individuals on the spectrum are decidedly pathological, and I'm not trying to broad brush the whole group of individuals on the spectrum. I'm just now focusing on how they might appear. So their oddness, as I said before, may look suspicious, but their mind blindness, and I'm going to show you a little video clip from a movie in a moment, prevents them from seeing the bigger frame of how their behavior is regarded, especially by police in the community. And therefore, they don't really anticipate what's going to happen to them. And this is important in custodial interrogations, that is under arrest, criminal interrogation transcripts where they're making confessions to things that perhaps they did not even do. The other thing is, like the individual in the anecdote who reacts to someone touching him to get the food off of him, which could be a normal social etiquette kind of thing, he treats it as an attack, and he treats it as something that he must get distance from. The question here is, well, he was charged with assault and battery, but was that his intent? And the question of what someone's purpose was might be different from a criminal purpose. So in my work with defense attorneys, prosecutors, and the parties involved in criminal or civil matters involving these kinds of situations, I often have to reinterpret these behaviors and these scenarios. Some of you may have seen the movie Adam. It's a 2009 movie, and looking at the demographics of this group, I can't see you on Zoom. Maybe this was a little bit before your time, but it's a wonderful movie. And it's a movie about a young man, and you'll see in this short clip that I'm going to show you, Adam is working, and he does what he can to do things mechanically. And he's high functioning otherwise, he's intelligent, but he's socially very awkward. And he gets fired, and he doesn't feel very good about it. And he, like the cliche you see in the movies, carrying around the carton with all his belongings from his desk and so forth, kind of bewildered, and he doesn't have a place to go. He's lost his vocational home, and he walks around sort of aimlessly, and he's got one friend who happens to be in his apartment building, who's a teacher at a school. But it's kind of pathetic, and then you'll see what happens, then we'll interpret it.
Excuse me, sir. What are you doing there? I said, what you doing?
Watching the children.
Uh-huh. Let me have some ID, sir.
I was looking at the children.
Sir, turn around. Put your hands on the fence, please.
Why are you doing this?
Lean forward. Put your hands on the fence, please. Turn around. Hands on the fence.
What are you doing?
I'm taking your wallet out of your back pocket to check your identification, sir.
15 Adam Central K. I need a name check. Adam, Rinky, Robert, Adam.
Is this the man you reported?
I wasn't the one who saw him.
Where do you live, sir? Please stay where you are. Do you live or do you have business in this neighborhood, sir?
Everything's fine. Going back inside.
Beth?
Are you the one who reported this?
Adam, what's going on?
You know this man?
Yeah, he's my neighbor. What happened?
15 Adam, Reiki, R-A-K-I, no hits.
He's clean.
All right. Sorry about that. Can't be too careful with kids, right? You can go.
I'm going to end that there. It's a great movie. Not as great as My Cousin Vinny, which is one of the greatest of all time. And I urge everyone interested in the law to see it. But Adam's a great movie. So what was Adam doing from his point of view? And by the way, I'm not suggesting here that the police officer did anything wrong, but still, we have 2 points of view. I'm going to take up Adam's point of view first. He was trying to walk off a bad day. He had a bad day. And you might say, well, he was there because maybe his friend, his neighbor Beth was there, or because developmentally he related to children, or he found children playing comforting to him. There's nothing sexual about it. Yet, if you have a guy staring into a schoolyard, and he gets reported here, you know, what's to make of it? Well, he has no idea why anyone would be interested in him. He was just watching the children. I'm looking at the children. He says it twice. It's like when in my cousin Vinny, I was talking about it with Dr. Weissman, and my cousin Vinny, when the suspect is asked, well, when did you kill the clerk? And he says, I killed the clerk, sarcastically. And then it's read back to him as, I killed the clerk, as a confession. So, if he had any sense of the impact of his statement to the police officer, I'm watching the children. He wouldn't have said it. You would not say that. The average person, the policeman comes up, what are you doing? Nothing. I'm doing nothing. Sorry, I'll move along. I'm not doing anything. Or I'm waiting for somebody. Or you'd come up with some reason. I'm watching the children, puts him in the sexually violent predator category. Hey, you can't be too careful with kids, the officer said. He's almost melted down, and he's very close. He's got sensory overload. He's being touched. He's bewildered. And here we go. This was an okay outcome, and this is fictitious. What was the police point of view? Police point of view, first of all, has dispatcher bias. Hey, there's somebody at our gate looking at the kids, and he looks kind of suspicious, right? It's not like he's a clear sexual predator, but still. So they're responding to a potentially dangerous person. Why is he dangerous? Because he's endangering the welfare of children, possibly, but it's not known. The officer and police officers don't like disobedience in citizens. They have different manners, and different officers have different ways about them. This officer was irritated. If I tell you to get up against the fence, you get up against the fence, and you say that way. The police officer is thinking already, this guy's going to give us trouble. And he's bothered by the lack of strict obedience. So, it ends peaceably with the ID clearing him and, a personal reference. Without that personal reference, he could have been arrested. What would the charge be? Loitering or being in the wrong place at the wrong time, but clearly not any kind of sex offense. This really upsets caregivers of people with autism spectrum. So these are quotes from a journal called Policing a few years ago. Concerned that officers would not understand a tantrum, running away, aggressive behavior to self or others, concerned if a nonverbal autistic person will not be helped properly by police officers. Now, this guy didn't run, but you can see easily whereby if someone does run, they can get shot and they can get killed. Again, I'm not here to say that police officers are out there doing the wrong thing on purpose, because once again, their job is much broader. It's to serve the community and protect safety. But here's another quote: not understanding that noncompliance isn't done purposefully, and his inability to respond to commands may cause rash action. Things happen very fast. And as you'll see with some of the videos I'm going to show you, they happen so fast that it gets out of control very quickly. I'm going to move on a little bit. So when the suspect now gets into an arrest situation, things are very bad, and the individual with ASD typically does not help themselves. So, for example, they may blurt out things like Adam did. Oh, I was watching the children. Or they may feel that they have a need for completeness and to get everything out in the open. So they say things that are against their interest, even though they've already been Mirandized. And they don't quite take in what's meant by anything you say will be used against you. They interpret it as, well, I better tell them everything so they understand me completely. and it works against them. So I would say in that sense, since custodial confessions must be knowing, intelligent, and voluntary, even though he may be knowing that he's talking to a police officer, the statement isn't given intelligently because he doesn't apply it to himself with an understanding of rights. And that's more of an advanced forensic point, but I want to make it here as well. So this gets back to phenotype. Custodial interrogations do not mesh well with phenotype on account of odd eccentric behavior. Not talking could be misinterpreted as evasive, untrustworthy, guilty. Only a guilty person would act that way, is one interpretation. The stress of a novel situation, I mean, it's hard to imagine it. And those of you listening to this may say, well, you know, we're told never to talk to police or suspend our rights. But on the other hand, if you're in a custodial confession situation, you may not adhere to what you thought you would do. And if you are, as an ASD person, you might be more inclined to respond to the demand characteristics of being asked a question without regarding what your rights actually are. So that's another element of this. So automatic obedience then can lead to a suspension of the right against self-incrimination. And nothing good can flow from that, really. Commonly reported incidents and use of force, you'll see them in the news now because they do make the news. And this is internationally. If I'm able to get to this toward the end, I'll mention that it's not just an American phenomenon. Individuals diagnosed with ASD are more likely to experience contact with the law in the community, but it's not on account of that autism is criminogenic. And that's a criminological term, meaning gives rise to criminal behavior. No one has proven that being on the spectrum causes crime or causes those people to commit crimes. It's more likely than not that there's a mismatch in the understanding of the behavior, which is construed by law enforcement and perhaps judges as criminal, whereas the individual in question was responding to something else: overstimulation, novelty, misunderstanding the motives of others, things I mentioned before. So to say that between 8 and 20% of autistic individuals have experienced law enforcement officer contact, that's a lot. That's a lot of people. And even 5% leading to arrest is probably greater than the general population. Unfortunately, sometimes this gets mixed in with civil commitment, involuntary hospitalization, and things that frankly can be toxic to the individual with autism spectrum. They do not necessarily belong in a situation where they're housed with people with serious mental illness. So the question is disability an abnormal situation? And what actually happens in real life? So we have the example here of 18-year-old Winter Stokes, who left his home one evening without his mother's knowledge, wandered into a stranger's backyard. Stokes has autism and is completely nonverbal, so which makes it a little more ambiguous as to what he was doing and why he was doing it. Officer attempted to apprehend Stokes and eventually dispatched his canine to stop Stokes from fleeing. All legitimate under the Fourth Amendment, search and seizure. Stokes suffered injuries requiring medical treatment, but more important, endured emotional distress and trauma from the incident. So sometimes these individuals are just minding their own business. Sometimes they're lost, like Winter was. Sometimes they're self-stimulating or stimming, and seemingly so bizarre that they are looked at as abnormal and therefore dangerous, which gets into the whole stigma piece of this. So it was dark outside, and the officer said, "Well, I couldn't really see what he was doing. For all I know, and I don't know exactly what he said, but he's thinking, for all I know, he could have been a danger to the community or to me," the officer speaking. So the court said, "Well, okay, officer, you acted reasonably." And indeed, that's a normalized scenario. Add race to the equation. There's some literature now on that individuals of color with autism spectrum disorder may be more at risk for police interactions. It's a complex intersection of race and disability, during police interactions. I'm quoting this source now, and that Black autistic people face additional penalties, as the author puts it, on account of both things that are potentially stigmatizing and subject to profiling, which is not exactly what you'd want ideally from a psychiatric point of view, but something that's almost unavoidable from a law enforcement point of view. Here's another example. Young Ryan had a behavioral incident, breaking a glass door and striking a family member. Now, I'm just placing this now in the context of a purely domestic situation. And police officers appreciate this, that domestic situations are among the most dangerous and volatile situations that they face. Okay, so there is a legitimate setup for this, but not necessarily for what follows. Ryan breaks a glass door, strikes a family member, family calls 911. And why shouldn't they? Law enforcement, because they can't handle Ryan, needs to be called. The sheriff sends deputies. Ryan appeared at the door with a gardening tool. When he disobeyed a command to drop it, he was shot. I believe I have a video of this. This is part of a news story.
When the family called for help, they certainly did not expect this outcome. It is a heartbreaking case for everyone involved.
Where's he at?
It happened in a matter of seconds.
Hey, get back! Get back! You're gonna get shot!
15-year-old Ryan Gaynor, armed with a gardening tool, is shot and killed on Saturday just before 5 p.m. in Apple Valley.
They called asking law enforcement for help.
Okay, I don't have to go on with that anymore, except to say that these things are all open to interpretation. And part of it, I mentioned it earlier, which is dispatcher bias. So parents are being completely sincere when they call the police for help. They call for help. I can't manage my son. My son hit one of us. But then again, from the police point of view, we don't know exactly what they were told. Did the dispatcher say, where there's a dangerous lunatic in the home, if someone with a weapon could kill somebody? We don't actually know. So part of perhaps what we can do is help with dispatcher training, as well as educating police officers and police departments on the contours of autism. But in this case, you might also ask, well, what was the officer doing with his gun drawn for a domestic situation? And the answer is simple, that these are dangerous situations, and that may be indeed their policy. But why they would feel the need to shoot is a subject matter later, because people will sue. And I'm not going to get into that in much detail until a few slides from now. Similarly, Lyndon Cameron was shot several times by Salt Lake police. His mother called 911 because he was having a mental breakdown, a meltdown, you might say. She told officers when they got there that Lyndon had autism spectrum, separation anxiety, and that he was unarmed. Nevertheless, they shot him several times. Now, whether it was due to genuine and reasonable fear for themselves or for someone else will be argued. But I'm just saying that there was a mismatch in the understanding of what mom was trying to say. Mom was trying to say, we understand this behavior. We just want to make sure everyone's safe. And that includes the police. No one set this up to be a danger to police. So the family sued and did win several $1 million, but the prosecutors did not charge the police criminally. Probably the most famous of these is the Elijah McClain situation in Aurora, Colorado in 2019. Elijah, and I'll show you a little clip from this. Elijah was a well-functioning and high-functioning art teacher in Aurora, but he was odd. When he went out, to diminish stimulation, he would put on a ski mask, which is pretty strange, but he did it anyway in all seasons. And he would have strange mannerisms, some of which you'll see, and he did not do well when he tried to explain his constitutional rights to the police officers. It did not go well with them because they were stopping him for a reason that they regarded as legitimate. And I don't doubt it because they were responding to a call, and they have to because they have to keep the peace. But nevertheless, it went south. So here's a little bit of a recording, which is available, I believe, on YouTube. And it's pretty upsetting, but I'm not going to show you the really upsetting parts because it's not necessary to make the point.
It's August 24, 2019 in Aurora, Colorado. A security camera picks up 23-year-old Elijah McClain at this Shell gas station buying soft drinks and wearing a face mask. His family lawyer told NBC News he was in the habit of wearing this mask. After paying for his items, he turns around and bows to the man behind him in line. His family told NBC News this was his signature gratitude bow. At 10:30 p.m., a man calls 911.
Let me see, he has a mask on. He looks good to you. He might be a good person or a bad person.
Yeah.
So, mask on.
Okay. Were any weapons involved or mentioned?
No.
Okay. What color is the mask or what does it look like?
Black.
Black mask?
He's like a...
Is it like a ski mask or what type of mask is it?
Yeah, like a ski mask.
Elijah McClain is walking home from a nearby Shell gas station. He's holding a plastic bag with his purchases. At 10:43 p.m., Aurora police officer Nathan Woodyard spots McClain.
Do a favor, stop right there. Hey, stop right there. Stop. 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 I have a right to stop you because you're being suspicious.
9 seconds after exiting his vehicle, the officer initiates physical contact.
Stop tensing up, dude.
10:44 p.m. Officer Jason Rosenblatt and Officer Randy Rodema are now also on the scene and surround McClain.
No, I am an introvert. Please respect the boundaries that I am speaking.
Stop tensing up. Stop. Relax.
Stop. I'm going home.
Relax or I'm going to have to change this situation. Stop.
Leave me alone.
Stop.
Can you please?
No operators, all right?
Leave me.
I want to stop it there. It does not end well because, among other things, Elijah got agitated. And as things were back then, it may be changing. The hospital was called and the EMTs arranged for Elijah to get a shot of 500 milligrams of ketamine to calm him down. And he did not survive the overdose. Now, what was Elijah McClain's crime, if any? And again, I didn't detect a large amount, or if any, of dispatcher bias. The dispatcher didn't say that Elijah had a weapon or that he was dangerous, only that he was acting suspicious. So American culture is supposed to be, if you see something, say something. But then again, seeing stuff is a matter of perception, interpretation. Hey, I see a guy with a ski mask walking down the street with a plastic bag. Okay, so what? But the police certainly were responding to a legitimate concern. they did what they were supposed to do. And Elijah pathetically said, I'm an introvert. He didn't have a bracelet that says, I have autism spectrum disorder, I'm sensitive to touch, I talk funny, and those kinds of things. He tried to hold his ground by saying, listen to what I'm saying to you, I'm different, I'm just going home, leave me alone. And they wouldn't stop. They needed to get closure on it to make sure that for the sake of the public that it was okay. So there we have it with him. Now, this was another case where there were not only civil charges or civil, for money charges, but there was also criminal. And there were some convictions in here. So the question was, well, what are the boundaries of this thing? And frankly, we don't really know, but it's bad for places like Aurora to have to pay out, $15 million, either in insurance money or out of their own coffers to pay for these things. So probably a little more police education on understanding individual differences might have helped in this case, even though the police were there for a legitimate reason and he was trying to stand his ground. The authoritarian piece of it kicked in and the police would not settle for Elijah's simple explanation. And similarly, and this again relates not simply to a person looking suspicious, but a family member calling in for help. And I just want to make the point, in case I don't get to it later, that during the life cycle of individuals with ASD, they may have aging parents because they're at home and they're living at home and they may be in their 40s or older, but they still may be susceptible to behavioral outbursts or meltdowns or to sensitivities more than their parents can handle at home. So here we have a case in Pocatello where the individual was not only developmentally disabled physically with cerebral palsy, but probably intellectually disabled and on the autism spectrum.
Tonight, outrage in Idaho after a 17-year-old with intellectual and physical disabilities was shot 9 times by police in his front yard. The family of Victor Perez now saying he is fighting for his life. Eyewitness video shows Perez lying on the ground holding a knife in front of his home. His family says he has cerebral palsy affecting his ability to walk. He also speaks limited English. You can hear in the video a woman saying no and attempting to restrain him. After about 2 minutes, police get there and 4 armed officers begin shouting at Perez to drop the knife. He's then seen struggling to stand up before he moves toward the officers who open fire.
All right, I'm going to stop that there. I think here it's pretty clear that mom wanted help, that there was a language barrier, that there was a misunderstanding of what this young man's behavior represented. They may have thought he was intoxicated and therefore more dangerous, or who knows. On the other hand, a bunch of police officers standing on the other side of a fence from a person who is questionably dangerous is probably overboard. It looked like a firing squad to me. And I think they probably crossed the line into behavior that was unnecessary. So here we have the outcome of this. So last thing I want to say about the statistics and the international perspective here is that it's a worldwide problem. It isn't just a problem of American policing versus ASD. And again, we'd like to be on the same side. Mental health would like to be on the same side as law enforcement whenever possible, because they need to learn from us about how to deal with behaviors that may look a certain way, but should be reinterpreted in a different way that we can shed light on. So even in places, civilized places, the UK, New Zealand, Canada, the statistics are about the same. A significant percentage of individuals with ASD are interacting with police. And I gave some of these scenarios already. But police do have limited knowledge, and my main message today is that whenever possible, we should help to educate law enforcement, including dispatchers, police, EMTs, and the communities that do not have embedded crisis intervention specialists will need a special amount of training to handle it themselves. If there's a crisis intervention specialist embedded or along for the ride, then you're in much better shape to interpret the behavior in real time. I'm going to skip one thing. I mentioned older parents, so there it is again. Overwhelming stress from caring for the autistic child or adult, as it turns out to be. I want to get to the end by saying that whatever else we do, we also need to educate parents and to see if there can be a rapport between parents of autistic individuals and the autistic citizens themselves, on the one hand, with police officers and police departments on the other. And there are consumer materials available through the Autism Society. And my last point here is that if there is such a situation as was described here, we can consider, although I'm not a big fan of registering people with mental illness, I am somewhat more in favor of registering people with developmental disabilities due to the gross misinterpretation of their behavior at times, so that the police or the dispatchers can have some heads up as to what they're dealing with, and that they're not necessarily dealing with a menace or a threat to the community. Rather, they're dealing with someone who is flustered, out of their element, and not sure what to do. So carrying ID, registration, and say where you are, and the kinds of things that Elijah McClain tried to, but these are the Autism Society's recommendations as to what to do, including disclosing the diagnosis. I have autism. So in Elijah McClain's case, he said, I'm an introvert, which probably sounded highfalutin, and the officers said, so what? It didn't sound like a disease model. So my bottom line here is, let's try to work with law enforcement to help educate them and the community also about the differences here between the ordinary criminal and individuals who may look a certain way due to their phenotype, who may have other motives or better explanations for their behavior. So with that, I think I'm going to stop and field questions that you may have from within the room and in the Zoom world. So thank you.
Thank you, Dr. Weiss. We'll look for questions, Dr. Lee, and then we'll attend to the Zoom question and point.
Oh, thank you, Ken, for a wonderful talk. And we talked a little bit about this. What is it? I mean, isn't it, we have a lot more heightened sense of violence in our community and in our society. So every interaction with the police seems to be more riskier than, let's say, 15 years ago. part of it is that, overall, there's a lot more guns around. The ownership of guns also has gone up. Now, I think 50% of the household has guns. How does that relate to this interaction between people with ASD and law enforcement?
I think it raises the temperature of things, as you suggest, Dr. Lee, because the world seems to be a more dangerous place with the proliferation of guns and the danger of domestic violence and other forms of violence in the community may lower the threshold for regarding any citizens as potentially dangerous. That's a problem. I would say also that dispatchers, like they did in the Elijah McClain case, should ask appropriate questions, such as, does the individual have a mental problem? And is there a weapon? Because they asked, is there a weapon here? And the answer was no. So that should cue the responding officers that they don't necessarily have to go loaded for bear, but to be on guard, because if it was serious enough for someone to call the police, especially the parents, then they need to regard it as a potential volatile situation. But I think you make a good point that the cultural milieu has upped the ante, so to speak, and renders every potential case a lethal case from the police point of view. Now, does that mean they shouldn't use discretion? They should shoot first and ask questions later? No, of course not. But I think that is a factor. I think the general level of fear in the community does militate towards these kind of scenarios.
Thank you, Dr. Weiss. There are a couple of Zoom questions and points from Dr. Peterson. What implications does autism spectrum disorder have for attorney-client relationship in criminal court cases?
Mm-hmm. The first thing is to see if the individual has intellectual disability baked into their syndrome such that they're completely fit to undertake the proceedings. Assuming that they are, the questions then become, was the custodial statement, the confession, valid and reliable? And that's something they need to look at. Also, to understand that the attorney needs to understand that individuals with ASD facing criminal charges, like in the scenario that I read right in the beginning, may militate towards this person looking bad, uncaring, callous. And these are qualities that we see in antisocial personality disorder as well. So that taint has to be removed. So the attorney also has to understand that if the case goes to trial, that there may be elements of the ASD phenotype that may work against them in court, especially if the individual has to testify, or even if they're just sitting there in the courtroom and looking bored or fidgeting, like they don't really care what happens. That's like they have no investment in the matter, like this kid in the scenario that I read in the beginning. So they need to understand those things, that these aspects of the phenotype may work against a smooth representation of the individual.
Thank you. Tzipora?
Sean's got some hustle today. We've seen it a couple times. Thank you so much, Dr. Weiss. I think giving a platform and some perspective to this particular population is extraordinarily important for a lot of reasons. The rate of diagnosis and our awareness collectively about how many people have autism spectrum behaviors and experiences is sort of mind-blowing. I will admit I'm struggling a little bit with the idea of a phenotype of a person with ASD because of how broad and vast the differences may be in presentation. I'm wondering if you can say something that focuses more on the interaction. a phenotypical interaction between law enforcement and a person with ASD, because there are decisions that are made in the field based on some sort of matrix of risk assessment that I certainly don't have training in or understand, that predispose this population to things becoming fatal or lethal or with significant injury. And I'm wondering if we can elevate the phenotype association to something that's more interactive as opposed to just about the individual.
Well, the interaction, I think, has to do with theory of mind, that the individuals with autism spectrum in the community, even the higher functioning ones, like Adam in the movie clip, don't really see what's coming. They don't frame it as that the police are simply trying to investigate something. They see it as a personal attack, or are completely bewildered, or can't wrap their mind around what the police officer might be thinking. So I don't want to broad brush individuals with autism spectrum, because the spectrum is so broad. And these days, when we talk about diversity, which now is forbidden in grant applications and that type of thing as a dirty word, we're really dealing with neurodiversity in a way that's meaningful and should not be broad brushed. So each case has to be looked at separately. But the phenotype in terms of the interactions is a misunderstanding by the individual with autism as to what the deal is, why they're interacting to begin with, and from the police officers or the responding officer's point of view, why are they not responding to me? Why are they acting this way? They're supposed to be acting obediently. They're supposed to be doing what I say, and yet they're acting in a different way. I think they're up to something. And there's really no meeting of the minds there. So I think that's where the action is with respect to the interaction. It's very hard for the individual with autism spectrum to talk their way out of it at that point. That's why it may be so important for them to say, I have autism, or to have a bracelet, or for them to recite something, or to even give a card to the officer saying, I have this particular problem, I don't like to be touched, I'm different, or what have you. Not to stigmatize them, but simply as a way to save lives. So I think that's the best I could say about that particular aspect of it.
Thank you. In light of the time, I want to combine two questions that were posed on Zoom. One of our faculty members, Judge Joanne Winslow and Dr. Sweet, sort of get to the point of having law enforcement either have a co-responder model or live camming it and having a mental health expert at their shoulder, so to speak, to help them deal with such a interaction. Thoughts about that, or are there movements afoot to address that?
Well, my thoughts are, whenever it's possible to have a crisis intervention specialist, or even by video or body cam, broadcast to a remote location, would be excellent to deal with problems in real time. But as you can see, if there are going to be situations where the training is go in with guns drawn, the likelihood, as Dr. Lee mentioned, the temperature goes up, the likelihood of someone getting shot is greater. So I think they also have to know from the outset that though domestic situations are dangerous, that having guns drawn may not be necessary if certain conditions are understood, that the person has mental illness or is neurodivergent or what have you.
And we're at the time limit here, but I want to close with it. I am aware, I have been involved in Monroe County where there is select training for sworn deputies as well as law enforcement officers here on managing individuals who have suspected mental health concerns, not specifically with autism spectrum, but I think we can continue to improve and assist our law enforcement professionals in our work. So thank you very much, Dr. Weiss, for coming in and answering questions. And thanks all of you.
Thank you.